Hi, I'm Connor Abraham.
And this is Luke Lemire, and we're doing a presentation on epilepsy. What is epilepsy? It causes abnormal high and irregular electrical activity in the brain, which results in seizures. While seizures themselves are not dangerous, their unpredictability can lead to fatal accidents. In cases of prolonged seizures lasting over 1 hour, immediate brain damage may occur. However, in most cases, the seizures themselves do not pose a threat to individuals' cognition. The main symptom of epilepsy is seizures that typically last anywhere from a few seconds to a few minutes. There are different types of seizures, and epileptic seizures don't necessarily affect every patient in the same way. Seizures may present themselves in the form of uncontrollable twitching, unconsciousness, staring spells, confusion, abnormal movements, feeling strange in general, and/or psychiatric symptoms like fear, anxiety, or déjà vu. A patient with epilepsy typically experiences the same type of seizure regularly. There are different epilepsies due to different underlying causes. Doctors aren't 100% sure of the specific cause of epilepsy, but there are situations that are directly correlated to seizures like severe head injuries, stroke and blood vessel diseases, tumors, changes in brain structure, brain infections, and also it may be hereditary. As discussed in the last slide, epilepsy is due to severe changes in electrical impulses, and that is shown in the picture to the right of the EEG.
After diagnosis, the typical first step for treatment is towards anti-epileptic drugs, also known as AEDs. AEDs are selected based on the type of seizure a patient experiences as well as other factors, and like many other psychiatric drugs, often require multiple attempts to find the most effective drug. While they don't work for everyone, up to 70% of patients may stop having seizures after finding the right medication. It is important to understand that AEDs do not work to cure or treat epilepsy. Instead, they work to prevent seizures to allow patients to live more normal lives. There are 4 subcategories of AEDs. Those that act on the inhibitory neurotransmitter GABA, those who act on the excitatory neurotransmitter glutamate, those who act upon sodium channels, and those who act upon calcium channels. To understand how AEDs work, we first have to understand the role GABA and glutamate neurotransmitters and sodium and calcium channels play within the nervous system. Let's start with GABA. When GABA is released into the synapse from the presynaptic cell, it crosses the cleft and activates receptors that allow chloride ions into the postsynaptic cell. These negatively charged ions hyperpolarize the postsynaptic cell, preventing it from firing. AEDs that act on GABA are called agonists. They work to increase the reception of GABA by the postsynaptic cell, which results in more chloride ions entering the cell, and therefore decreasing the activity of the nervous system. AEDs such as gabapentin work to increase the production of GABA. Others, like vagobatrin, reduce the breakdown of GABA, allowing them to have an effect for a longer period of time. Benzodiazepines increase how often GABA receptors open. And finally, barbiturates keep the GABA receptors open for a longer period of time. All of these GABA AEDs produce an inhibitory effect. The next neurotransmitter, glutamate, is essentially GABA's opposite. Glutamate also works by regulating the flow of ions into and out of the postsynaptic cell. However, it typically produces an excitatory response, increasing the activity of the nervous system. AEDs that act on glutamate are antagonists. They work to decrease the effect of glutamate in the nervous system. Some glutamate AEDs, like perampanel, work specifically on glutamate receptors, while others, like topiramate, work on glutamate receptors as well as other targets. Glutamate AEDs reduce excitatory responses in the nervous system. With calcium channels, when the action potential reaches the axon terminal, calcium channels open, allowing calcium to flow into the cell. These calcium ions bind to the synaptic vesicles, allowing them to release their contents into the synaptic cleft. AEDs that act on calcium channels work to regulate the flow of these ions within the nervous system. Calcium channel AEDs work to reduce the flow of calcium ions into the presynaptic neuron and therefore reduce the release of neurotransmitters into the synaptic cleft. Overall, this reduces neuronal activity. Examples include lamotrigine and topiramate. Finally, sodium channel AEDs are a little different from all the others because they work to inhibit the action potential as it travels down the neuron. An action potential is moved down the axon by voltage-gated sodium channels. AEDs that act on these sodium channels inhibit the flow of sodium into the cell, which keeps the action potential from continuing. Examples of these include phenytoin, lamotrigine, and carbamazepine.
Another treatment is known as deep brain stimulation, or DBS therapy. It can be used to treat epilepsy in patients whose epilepsy is hard to treat with typical procedures like surgery, which will remove a portion of the brain that is causing the seizures, or AEDs. DBS is a battery-powered neurostimulator that sends the electrical impulses into the brain. The electrodes are implanted by a neurosurgeon into the anterior nucleus of the thalamus, or the ANT, which plays a role in the spread of seizures, as the ANT predominantly deals with afferents or inputs from the mammillary bodies. This works with AEDs to help reduce, not cure, the seizures. It works to reduce the frequency and severity. As we talked about before, many people use AEDs to help reduce the frequency of epileptic seizures. The ketogenic diet, or KD, is typically used by children to further control the frequency of seizures. Ketogenic diet is high in fat, low in carbohydrates, and adequate in proteins. These include meats, high-fat dairy, greens, avocados, nuts, and many other foods. The body is forced to burn fat in place of carbohydrates, which is usually transformed into glucose, which plays a big role in fueling brain function. As the KD causes little carbohydrates to exist in the diet, the liver converts the excess fat into fatty acids and ketone bodies. The ketone bodies are then used in place of glucose as an energy source. Elevated level in ketone bodies in blood causes ketosis, which leads to reduction in epileptic seizures. Another treatment is brain surgery. Surgical treatment for epilepsy is usually reserved for extreme cases in which other treatment options don't work, and in which the source of the seizures can be localized to a specific area of the brain. One type of surgery that has become well known due to its unique side effects is the corpus callosotomy. The corpus callosum connects the hemispheres of the brain and transmits information between them. This includes the spread of seizure impulses from one hemisphere to the other. In this surgery, the corpus callosum is either partially or entirely cleaved, disallowing communication between the two hemispheres. This type of surgery is typically very effective. However, as you can imagine, they can result in serious side effects. Patients experience unique issues with interpreting visual information, speech, facial recognition, emotions, and more due to the fact that each hemisphere plays a different role in these tasks and are no longer able to transmit information to one another. To conclude, there is still research out there to better develop treatments for epilepsy and to better understand it and its causes. But if well managed, patients, or most patients with this disease, can actually live a somewhat normal life.